A 22-year-old male presents with a chronic cough productive of purulent sputum. I am showing you his frontal chest radiograph and an axial chest computed tomography scan. Describe the findings.
The chest radiograph demonstrates dextrocardia, with the cardiac apex pointing to the contralateral side and the gastric air bubble transposed under the contralateral hemidiaphragm, indicating situs inversus totalis. There are also bilateral basal parallel linear opacities and ring shadows. The axial chest computed tomography scan confirms situs inversus totalis, showing complete transposition of the abdominal organs, with the liver and spleen reversed. There is also bronchial wall thickening, cylindrical bronchiectasis, and tree and bud nodular opacities, predominantly affecting the anatomical middle lobe and lingula.
State your primary diagnosis and the clinical association shown on these images.
The combination of situs inversus totalis and bronchiectasis is diagnostic of Kartagener's syndrome, which is a congenital disorder of mucociliary clearance.
If I tell you the patient has a history of chronic sinusitis since childhood and was referred from a fertility clinic due to semen analysis showing completely immotile sperm, how does this clinical history complete the picture?
This clinical history confirms the classic Kartagener's triad of situs inversus, bronchiectasis, and sinusitis. The immotile sperm are due to the same underlying ciliary microtubular defect, confirming the diagnosis.
What is the pattern of inheritance for Kartagener's syndrome?
The pattern of inheritance is autosomal recessive.
Describe the ultrastructural defect that causes ciliary dyskinesia in these patients.
The most common ultrastructural defect is the absence of the outer or inner dynein arms in the ciliary axoneme, which prevents the normal sliding of microtubule doublets and compromises ciliary motility.
Explain why situs inversus occurs in approximately 50% of patients with primary ciliary dyskinesia.
Normal embryonic ciliary beating is required to establish the left-right concentration gradient of morphogens during embryogenesis. In primary ciliary dyskinesia, the lack of ciliary motility results in random rotation of the internal organs, leading to situs inversus in half of the patients.
Compare the distribution and severity of bronchiectasis in Kartagener's syndrome with that of cystic fibrosis.
Bronchiectasis in Kartagener's syndrome has a predilection for the anatomical middle lobe and lingula, and it is typically less severe. In cystic fibrosis, bronchiectasis has an upper lobe predominance and is typically more severe and progressive.
What other paranasal sinus abnormality is frequently observed on imaging in these patients?
Paranasal sinus imaging frequently shows sinus opacification and hypoplasia or aplasia of the frontal sinuses.
What is a critical surgical or diagnostic pitfall regarding acute abdominal pain in patients with situs inversus totalis?
Because the cecum and appendix are transposed, acute appendicitis in these patients presents with left lower quadrant abdominal pain, which can lead to severe diagnostic delay and potential perforation if the situs inversus is unrecognized.
State the critical safety warnings and management recommendations for Kartagener's syndrome.
The critical safety warnings are diagnostic delay in left-sided appendicitis, progressive bronchiectasis leading to respiratory failure, and cardiovascular anomalies. Radiologists must immediately recommend respiratory medicine referral for airway clearance therapy, suggest genetic counseling, and warn the clinical team to screen for left-sided appendicitis if acute abdominal pain occurs.